All right, folks, I'm going to give you guys a little bit more of instructions before we get started. So again, thank you so much for being patient and bearing with us as we are getting more people in. I want to get a little bit more people in so we can all start and they all get the same information. And let me give instructions again to our Spanish speakers. So thank you so much. Para las personas que están entrando al español, gracias por su paciencia. Estamos esperando a que entre un poquito más de gente a la reunión. La reunión va a ser en inglés, pero vamos a tener interpretación simultánea. En su pantalla ustedes pueden ver el icono del mundo o una bolita que dice traducción o interpretación. Háganle clic y cuando empiece la presentación van a escuchar la voz de nuestra compañera María que les va a estar diciendo la presentación en español. Okay, así es que muchísimas gracias. So thank you guys as we're speaking Spanish and giving instructions to our parents who are Spanish speakers. So thank you for your patience. And at this time, I think we're going to get started. I know more parents are coming in, but I also want to be conscious of the time that you're giving us today. So thank you so much for joining us. My name is Berenice Pan, and I'm a FACE Manager, Family and Community Engagement and Education for Chicago Public School. I support Network 4. But I'm also a parent. My munchkin is a Chicago Public School student. So just like you, I have many questions, right, and concerns. So we're hopefully this hour, we learn together, we get some questions answered. And hopefully if you guys have more questions and things like that, we're gonna give instructions on how to do that, okay? So a couple of things before we get started. This session is gonna be recorded. We wanna make sure that parents who were not able to join us can see it later. So it's gonna be put up on our YouTube channel. You guys see the link there and we will email it to you guys as well if you wanna see this again or share with other parents. We will start the session with a short presentation with Dr. Fox, just information that we think is important for you guys to learn. We'll do introductions. Today we have two people that are supporting us. We not only have Dr. Fox, but we also have Dr. Zimmerman that's gonna help us out today. And then we're gonna go through some of the questions that you guys submitted. As you guys RSVP, there was a section for you guys to submit questions. So we're gonna get started after the presentation with those questions that you guys submitted. We will open the chat 15 minutes before the end of the session to give you an opportunity to put additional questions in the chat. Please know that we might not be able to get through those, okay? We're gonna try to answer as much as we can, but just bear in mind with the time that we have, we might not be able to get to those. At the same time, there might be questions that you have, I know with how the classes are going to be set up, with airflow and that kind of stuff. We are going to have a session with Chief Carson that will be answering those questions. So I don't want you to think that I'm not reading your questions. We are, but we're going to move those to those individuals or those chiefs that will be answering those questions for you in a letter session. And today, you guys, thank you so much for giving me your time. Like I said, I know it's been a long week, so we appreciate the hour that you're giving us. You're here and Ask the Experts and why it's safe to return to school. And it's a face-to-face program offering, virtual offering that we have for parents and community from Chicago Public Schools. As I mentioned, we have sessions that Ask the Experts is every Thursday, same time, same channel. So you guys can tune in and see what we have. Next week, we're going to have Chief Clarkson that's going to talk about facilities. And at the end of the month, we're going to have Dr. Jones from Special Education, ODLSS, that's going to join us and answer questions. If you guys haven't done so already, register and put your questions in so that we get them ahead of time and we're able to ask our chiefs. And today's speakers, we have Dr. Kenneth Fox from Student Health and Wellness. As you guys might know, Dr. Fox is a pediatrician with over 30 years of experience and now joins CPS and helping us maneuver everything that's health and wellness with our student and our community. And I'm gonna let him introduce himself in a minute. I also wanna introduce you to Dr. Laura Zimmerman coming to us from Rush University Medical Center. And I'm gonna let her introduce herself a little bit more too, but no, she's one of the experts that have been supporting the work that we're doing. So Dr. Fox, I'm gonna shoot it out to you if you wanna introduce yourself.
Hi everybody, this is Dr. Ken Fox. I am the Chief Health Officer of Chicago Public Schools. I have been a pediatrician for over 3 decades, but I gotta tell you, I have never been through something like this. So this is quite a moment, and we are just so glad to be invited to be part of this, because we all have to be working together to make our way through and do the best things that we can do to keep everybody healthy and safe.
Thank you so much, Dr. Fox. We appreciate that. Dr. Zimmerman?
Sure. Well, welcome everyone. I'm really honored to be here with Dr. Fox and with the CPS team. Yeah, I'm a general internist and I have been in practice for about 10 years. And I trained at Northwestern and am now at Rush. I've been in Chicago for a long time, grew up in the area. And I'm happy to be here today to answer things from not only a scientific doctors or physicians perspective, but also to talk a little bit about my own personal experience with my children who've been in-person learning since the beginning of the year in organizations that do serve communities that are highly affected by COVID-19. And so I'm happy to share both the scientific perspective and the personal perspective in terms of returning to school safely.
Thank you, Dr. Zimmerman. I think that that's going to be very well appreciated to get the perspective from a mom, right? A lot of us moms worry a lot about what's going on and just want information. So we really appreciate that.
Hey,
Dr.
can I
Fox?
can I can I offer my thanks to
Yes.
Dr. Z for joining too? I'm just so thankful. I mean, I'm a dad, but my daughter is all grown. In fact, I'm gonna be a grandpa in about 3 weeks. So
Wow.
I just want to say thanks to Dr. Z for joining, and we're gonna just go back and forth here as we're answering the questions. That's really the focus of today. We did pull together a few little slides. This is maybe 2 or 3 minutes. We'll just quickly buzz through because I just want to make sure everybody's on the same page and knows what I'm talking about when I talk about the health and safety plan at CPS.
Perfect, Dr. Fox. Thank you so much. So we're going to get started. The presentation's up. You let me know when you want me to move.
Oh yeah, let's go.
All right.
Let's go ahead. Forge ahead. All right. First point is this: we have power here to protect ourselves. You know, we're not powerless in the face of this pandemic. It's tough. It's terrible. It's terrible. But there are things that we can do to protect ourselves. And this slide really depicts the main ones here. We call these the 5 key strategies to stay safe. We think of this like as different layers of protection, and these are endorsed very widely, including by the Centers for Disease Control and Prevention. But the first of these 5 is everybody's got to wear the cloth face coverings. You know, we all know this, we all see this. Everybody's got a whole wardrobe of cloth face coverings, but that's number 1 on the list. That's the first key strategy to stay safe. The second important thing is that we social distance. We keep that protective force field around us, in a sense, 6 feet distance between us and other people. And you know, there are a bunch of reasons for that, which we can talk about, but that's number 2. Number 3, clean hands, right? We got to be about the clean hands and also covering our coughs, right? The 4th is cleaning and disinfection, right? So in situations where we know about a case, or even, you know, ahead of a case, we want things to be clean, and we don't want germs on surfaces, and that's a big part of the layers of protection. The final one that I want to mention here is contact tracing. And we'll talk more about all of that. I think some of the questions are about contact tracing, so we'll get into that. But this is essentially the process for finding out who the direct contacts of the case are. And that's important because we want to put those direct contacts into quarantine. Anyhow, we execute this 5th and important key strategy, and we do this, you know, working with our colleagues in the Chicago Department of Public Health. You know, the other point I do want to make here, this is a takeaway. If you're sick, stay home. If you're sick, stay home. And that's really important in CPS and in other workplaces as well. Let's keep on going. Next slide, please. I think this slide gets into a little bit more detail. Aside from those 5 top key strategies, those 5 top layers, there are other things that we're doing as well that will help to keep us safe. And the first one I want to mention up here is a daily health screener. So Each day before people enter a CPS building, we ask them to complete a health screener. It's a series of like 7 questions, really. You can do this on your phone, on your laptop, on a tablet. If you don't have your own, you could do it inside of the school. There'll be places where that is made possible. But anyway, the daily health screener is an important thing because essentially we want to keep the sick and the risky totally away from the healthy. That's the whole point of the screener. So it's a simple, easy, quick thing. You can do it. I just did mine. I'm down at my office downtown. I had to do it myself. It takes about, 20 seconds once you're signed in at most. And we'll just get used to it because it's just part of the routine of how we do school now. Once you clear the screener, and on the screener, when you pass the screener, you get a green sign on your phone. Green means go, green means enter, green means come on in to in-person learning. If for some reason you don't pass the screener, one of the questions makes you and everybody else know that it's better to stop and not enter on that day. That's the other thing. So there, green means go, red means stop. And that's how the screener works. But once you do the screener, if you got the green sign, if you got the green light, then you get the temperature checked super quick. The others we've talked about. We talked about closed face coverings, and hand hygiene, and keeping the distance. But another point here is that kids in schools are going to be organized into these things called pods. So this is a small fixed group of kids, kind of like a household in a sense, people who are stay together, because we don't want people mingling just randomly. You know how kids, mingle randomly through the school ordinarily. Well, we can't do that anymore. People have to be organized into pods, and that's an important layer into strategy. We've talked about cleaning and disinfecting, how that's done. We had, our custodial staff knows exactly how to do this, how to keep the spaces safe. They are equipped to do it. They have these special, we call them like Ghostbuster packs. They're these sprayers that they have on their backs, and it's part of how they help to clean the spaces. Another important feature, though, is making sure that the indoor air quality is what it's supposed to be. And we've guaranteed that because we have audited all the schools. We inspected all the schools. Actually, we had multiple experts, industrial hygienists, they're called, to come and help us to assess the indoor air quality of the schools. And that's the foundation of that is the mechanical ventilation system. So where you have an operating mechanical ventilation system, that's your main source of protection in terms of indoor air quality. But there are others too. We've made some investments in these HEPA air purifiers, and that's a supplement, that's on top of really the foundation of a mechanical ventilation system. Also in schools, you'll notice when you and your kids get there, some people will be wearing personal protective equipment, but that's really based on the job task at the school. There are certain kinds of PPE, as we call it, that are required based on your level of exposure to the germ and the task that you're doing in the school. Also, just around this part up, there are, we've invested in plexiglass dividers all through schools, and also lots of signs to remind people of ways that they can keep themselves safe. So essentially what I'm saying is that we have many resources, and we have a comprehensive plan that's really designed to keep us safe. Let's go to the next slide, please. I think we just have one or two more here. So this is a point that I thought was important to make. We're in a very different place now than we were at the beginning of all this, at the first wave back in the spring. And as you may recall, I don't know if everybody knows this, but almost all the kids across the globe were out of school. That happens to be about 1.5 billion students all over the world out of school because we weren't sure whether it was safe for them to be there or not in person. But over time, fortunately, we've learned a lot. And now about 1 billion of those students are back in school all over the world. People all over the world are back, including in the US and even in Chicago. We're going to talk about that more on the next slide before we close things out. One of the things that's become evident, and this is just one source of this evidence, came from UNICEF, which is a very reputable organization and very knowledgeable and insightful about issues like this. What they have reported is that there is scientific evidence from over 191 countries across the world showing that there is no consistent association between school reopening status and COVID-19 infection rates in communities. They looked at many, many studies from all over the world, and this is what they found. And this is largely the reason why so many of the world's children are back in school. The bottom line is that the net benefits of keeping schools open outweigh the costs of closing them. That is where the evidence has led us, and that's why we think this is a good idea for our kids too. Let's wrap it up here. This is just more about what we know now that we didn't know before. We've covered a lot of this. I'm sure we'll get into a lot of it during the question and answer. The bottom line, these layered strategies, these mitigation strategies, sometimes people refer to them that way, they work. They work to make in-person education safe in schools and in daycares. That's what we know now that we didn't know at the beginning. That's an important insight because, kids miss out on a lot when they're not in school, even when remote learning is set up for them. Maybe that's it. One more slide, I think. All right. Okay. I don't want to dwell on this. I'm sure we're going to get to this in the question and answer, but part of what we're doing here, this is just another strategy, is a testing plan. We're doing something that's called surveillance, and we're just trying to measure, well, how common is this germ among people who don't have symptoms, right? If people have symptoms, there's a clear course of what you have to do. We'll be talking about that as well. But what we are interested in is, how common is this among people just walking around, who are not having symptoms? And so the testing plan that we've put into place really helps answer that question right now. This is a voluntary thing for staff, and we are surveilling about a quarter of the staff each week, so that all told, a staff member has, all staff members are covered about once per month. So that's that. I think the very last slide is just more about testing. Part of how this works and why it can work is because there's such a quick turnaround now. There's a rapid test, there's a 15-minute turnaround. We have these people who are trained to supervise the test, run the test in the school. These are mobile teams that are out in the schools. And what we do is a rapid test. Once we know about a positive rapid test, that's sort of a preliminary test. We call it a presumptive positive. And what we do, just to be on the safe side, is we isolate that person. We do a definitive kind of test that takes a little bit longer, 24 to 48 hours. And then if that definitive test is positive, then we do, we set the contact tracing team into motion to really figure out those direct contacts and to, put people into quarantine if they need to be. For people who actually have symptoms, we have a different strategy. It's not just surveillance. We really want those people tested. So if you have symptoms of COVID, you're supposed to get a test. The first place to go, the best place to go, we think, is your regular doctor, your primary care provider. Just like, the pediatrician I was for 3 decades and Dr. Z is right now. Not everybody has that. Not everybody has easy access to it. If you don't, there are other options. For example, there are testing sites all throughout the city. There are federally qualified community health centers as well. These are, they see everybody regardless of ability to pay in most of those sites. And we also have our academic partners like Lurie Children's or UIC and Rush. I think that's it for the slides. Let me just.
I think that you're right. That's the
Yes,
last slide. So I'm
thank
going
you.
to stop sharing. Thank you so much, Dr. Fox,
Sure.
for that information. I think it's a lot of information. So I'm going to give it a minute for people to kind of like wrap their head around all the information that you gave us. I know some of us are taking notes, so making sure. We're going to kick up the conversation with the questions that participants submitted during their RSVP. So I want to make very clear, all the questions that I'm asking are from parents, community organizations that register and provided us questions ahead of time so that we have them ready for you and Dr. Z. So let me start with this one. In terms, the parent says, in terms that can be easily understood, can you explain the metrics that, that you are using to decide whether the community spread is low enough to make it safe to return to school? Is there a way families can easily look this up in order for them to make the decision if they want their kids to return to school? And then
Sure. Thanks.
is there a big difference in the rate of community spread by neighborhood?
Yes. Okay. Thank you for that question. It's very, very important. We're learning, as I said, we're learning more and more as we go, through, all kinds of global studies, national studies, and even local ones. There is no single metric that establishes with certainty what schools should do. Okay. We have learned about metrics that we thought were important, but we found out that they're really not. They're not important. For example, some people have heard about test positivity rates, right? Some months ago, people thought, oh, follow test positivity rates and you'll know whether it's safe to operate schools or not, for kids to be in school, in person or not. And so different numbers were thrown around. And what we found is that schools can operate safely in person when the mitigation strategies are in place at much, much higher test positivity rates than we ever knew. And even some places got sort of backed into a corner. Like, for example, in New York, back a few months ago, they had committed to a certain test positivity rate. They said, if the rate's over this, in fact, in their case it was 3%, that we will not be having kids back in person in schools. Well, what we found out is that really wasn't a valid number. It didn't have as much meaning as what we thought. And it became quite evident that you could operate schools safely in person at much higher rates than that. So we threw that out of the window. They did so in New York. They just, threw it over the side, and they've been operating schools, even though their test positivity rate is higher than 3%. So that leaves us to reach for, well, what can we use? And here in Chicago, the Chicago Department of Public Health has now advised us the very closest thing that we can come to, the best thing that we can look at based on previous experience is what is the doubling rate? What is the doubling rate for cases in the city? What we learned in the first wave was that when the doubling rate is 18 days or lower, we're in trouble. Okay? That doubling rate tells you about whether the pandemic in your spot is controlled or if it's not controlled. 18 seems to be the right number, seems to be the right cutoff, and that's the one that we're working with right now. Okay, fortunately, our doubling rate in Chicago is like 86. It was 86 the last time I looked at it, which was, I think, yesterday. So 86 days. So not even close to the point where we think that may be best to not be learning in person. So right now, we're working with the doubling rate. Our doubling rate in Chicago is, it's okay. It indicates that the pandemic, though it's clearly not over, it's controlled enough so that you can safely operate in person. Also, we have the benefit of looking back these past several months at, schools operating successfully and safely with all the mitigation strategies in place, right? At much higher test positivity rates than we ever thought possible, right? Like, for example, 138 schools in Chicago, tens of thousands of students have been back in person since the summer. They've opened those schools safely. That doesn't mean that there aren't cases, but what we've observed is there are net significant outbreaks in schools, in those schools that are operating in person. So we kind of have the benefit of others going before us for several months and operating in Chicago, even when we were at the height of the second wave. Also, daycares, right? They've been in operation in Chicago. This is almost 3,000 daycares operating safely in Chicago using the mitigation strategies for 6 months. Are there significant outbreaks in daycares? No, there aren't. So what we know is that the metrics can be tricky. The one that we're focused on right now is the doubling time. And we have already seen tens of thousands of students attending over, 100 and, almost 140 schools and over almost 3,000 daycares that you can do this in person safely.
Thank you, Dr. Fox, for that. I think that's a lot of information, and it's good to know, right? A lot of what we're using and not using to make sure that we're reopening on the safest way possible, right? And comparing those other schools and even the city of New York, as you mentioned. So thank you for that. Appreciate it. So on that same note, I know parents now you mentioned, right, there are cases, it does happen. So parents want to know, who will be required to quarantine if somebody is found to be sick?
All right, let me jump in on this. Dr. Z, jump in here if I leave something out.
Sure, of course.
But really, the point is this: you quarantine for 14 days. That's what you do if you're a direct contact of a known case. Now, by direct contact, we mean something very specific. You are within 6 feet distance for 15 minutes or longer of a known case, a known COVID case, over the course of a day, 24 hours, during the case's contagious period. Okay, so there's a bunch of pieces to that definition, but we're going to break this down. Now, the other thing to know is that the contagious period for COVID, that's 48 hours before you start to have symptoms and until 10 days after the start of symptoms. Okay, so the different pieces to the definition, they matter for this direct contact thing. They all matter. It's over 6 feet. If you're outside of 6 feet of this person, it doesn't matter. It doesn't matter. You have to be within 6 feet. If you've been with that person, let's say you were inside of 6 feet, if it was less than 15 minutes with the person, no, you're not a direct contact. That's part of the definition. If you were with that person before their contagious period started, nope, you don't worry. That doesn't make you a direct contact. If it was after the person's contagious period, again, no, you're not a direct contact. So the key thing to know is that you quarantine if you're a direct contact, and how you know whether you are a direct contact depends on if you fit those pieces of the definition that we talked about.
Fantastic. Thank you so much. Dr. C, I don't know if there's anything that you want to
Sure.
add to that?
Yeah, no, I was just going to say I mean, that is the CDC definition, and that's the definition we use in our healthcare settings as well. So very
Fantastic.
specific definition for contact and exposure.
Thank you, guys. Thank you to both. And I think it's important to know as we continue to hear things, right? As parents, we definitely worry when we hear like there's a case here. So it's good to know the exact definition and what you guys are going to be looking at if you're going to put somebody in quarantine or like shut down a pod or something like that. So thank you for that. On that same note, one of the things the parents also want to know is, will a negative COVID test be required to return to school when people are put in quarantine? Yes. If yes, why? And if no, why?
All right. It might be easier to think about this like, let's say if you have COVID, okay, you have a positive test, okay, you're going into isolation, not quarantine. Okay, if you have COVID, you isolate for 10 days. All right, this is the first time we're talking about the 10-day thing, right? Which is kind of confusing, but let me just say it right off the bat. Okay, if you have COVID, you isolate for 10 days. Now, here's how you can remember this. Why are you isolating for 10 days? Well, you do that because that is how long it takes your body to get rid of the live whole virus, okay? Once that happens, you've gotten rid of the live whole virus, you're no longer contagious to other people. If you're no longer contagious, no more isolation, okay? But the thing is this, even after your isolation ends, there's like little bits and pieces of the virus still left over. And they can be there, kind of like trash, you know? You fought the battle, there's trash on the battlefield, right? Okay, but that trash could be there for weeks and months afterward, the little bits and pieces, okay? Those bits and pieces, they would make your test positive, okay? So they're there, but your repeat test, if we ask you to repeat the test, it might still say, hey, COVID positive, okay? However, those little bits and pieces, they don't make anybody sick. So all that to say, repeat testing, it's not that helpful. What is most helpful is that you isolate for the right amount of time. Repeat testing, it would be confusing. It's not necessary, so we don't do that.
Got it. Thank you. And I mean, that's good to know. I had no idea. So thank you so much for illustrating. I think a lot of us are like, if you get it, go get tested again, right? Like that's like the first
Right,
human.
yeah. Don't bother.
Got
You're
it.
probably
Got
going
it.
to be positive, you know, but that doesn't mean that you're contagious. Your contagious period is over after 10 days. And that's why we say your isolation period is over. And that's why we say that's when you can return.
Got
You
it.
don't need
Thank
a
you.
repeat test. You need that time.
Perfect. Thank you so much. I think that makes it clear, and I think better for us as parents and just people that we know that had it. Thank you so much for that. In that kind of same line, I know we talked a little bit about quarantine, who does it, who doesn't, and you talked a little bit about that. One of the parents wants to know, will family members of a person who tested positive, do they need to be quarantined also if they go to a CPS school?
All right. Let me just quickly throw something at Dr. Z. I'm going to need your backup on this one, though. Okay. The key thing, it's not so much the family, it's the household. So everybody in the household is considered a direct contact. Okay, automatically, if you're in the household living together with the person who's the case, then you're a direct contact and you go in a quarantine. Okay, and that's whether the person's really in your family or not. You know what I mean? Like growing up, there were all kinds of people who lived in my household that, technically I wasn't related to them. It was my play cousin, it was our close family friend, right? So that person wasn't in my family, but they were in my household. Okay, so the key thing to think about is, are they in a household or not? If you're in a household of somebody who's a known case, yes, you would be a direct contact, so you go into quarantine. So now, if it's family that's living outside of your household, no, that's a different story altogether. Okay, what matters is how physically close people are to each other, because that's how it's spread.
Got it.
You know, by the droplets that happen in person. In a household, that closeness makes you a direct contact.
Got it. Dr. C, is there anything do you want to add to that?
No, I mean, I concur. That would, you know, and if you spent time with that person during their contagious period, if you were within 6 feet of them for more than 15 minutes out of a 24-hour period, then that is considered exposure and contact, and that person would need to quarantine as well.
Got it. Thank you guys for that. And I think it's a good point to make the difference between, right, like people who are related to us, but they don't live with us, but people who live with us might not be related to us, and what a family, right, that lives together would be, because we all have different kinds of families. So thank you for that. One of the other questions that one of the parents submitted was, will CPS do what New York schools did and have tests for students returning, especially since this is the only way to identify asymptomatic individuals?
Right. Well, we definitely are testing the school staff. Okay, we're definitely doing that. There's an open question about whether we ought to be testing students or not, and we're being really careful and deliberate about that question. Okay. Again, we kind of have the benefit of seeing what others have done. And I just want to bring this up because I think it's not necessarily widely known. Okay, but I just want to say this. And Dr. Z, you check me on this and add anything else that I miss. But if you look at the New York example, right, they've been testing staff and students for 3 months. Okay, the past 3 months. They have conducted about 270,000 tests among those staff and students. Okay, they do them at a certain interval. It's a certain proportion of the population of staff and students. But it is all added up to 270,000 tests in New York in the schools. Okay. What have they found among those asymptomatic people that they tested? What they have found is about 1,000 cases of COVID out of 270,000 tests, about 1,000 cases, okay, which amounts to less than 1%. It's like 0.4%, which is pretty low, you have to admit, okay? Now, have they spent some money on this? Yes, they have. Those tests are about $100 a pop. If we paid that same rate and had those same, did that same thing, we would have spent $27 million in 3 months. If you wound that out to a year, you're talking about $100 million worth of testing. For what? Very low yield. So we're struggling with it because, you have to decide where are you going to put your resources, and it's such a hard question. What we've definitely committed to is the testing, doing the surveillance testing among the staff. What we're thinking about is whether we should follow that New York path and spend the money, even though we know it's pretty low yield. That's a question, and it hasn't been settled yet, but we're thinking hard about it. We're asking the experts and trying to make sure we make the right choices so that everybody, feels safe.
Got it. Thank you, Dr. Fox. I think it's a good explanation to know. I know a lot of our parents always ask about like New York and what New York is doing. So thank you. I appreciate that answer and being really transparent with what you guys are thinking of doing. The other question another parent submitted, It's about, let me see, let me read it here. I am unsure if students will have communal eating and recess at the time when they're in school. However, is the risk of transmission higher during these activities?
During meals, yes. Any kind of mask down situation, if your mask is down, yes, that's a higher risk situation, right? It's still, fortunately, you have these other layers to protect you, right? That's why we're keeping the people 6 feet apart. Because remember, in our direct context, definition, it's about being a certain distance apart, right? So any mask down situation, yeah, that's riskier than a mask up situation, for sure. However, I mean, what are you gonna do? Kids gotta eat, kids gotta drink. You can't just sit there for all those hours and not eat or drink. That would be bad too. But there are ways to do it safely, and that's what we're doing. Now, at recess, no, they had to keep their mask on during recess. So, we also, or it's like encouraging, kids to stay apart. But obviously, they're going to run past each other, and that's okay. We are, sadly, I mean, it just kills my soul to know we're closing the playground equipment. They can't use it. But, kids find a way. They find a way to play. They find a way to have fun. And they're going to do that. They're going to teach us how you have fun in this context by, observing the safety protocols and so on. It's still going to be recess. It's just going to look different than it ever has before.
For sure. Dr. Zimmerman, is there anything you want to add?
Sure. I mean, just in terms of safe eating, I know, CPS plans, I know you all are planning that the students will eat within their pod. So they won't be going to a large area, congregating with several other students. They'll be eating with the same, basically household that's created by the classroom pod. And yeah, there are things you can do. I mean, being 6 feet apart, all facing the same direction, so in theory, everyone's droplets are going away from the other students and not towards each other. So there are several things that you can do during those mask down situations in order to lower the risk during lunchtime. And same thing with recess. What we found is, small kids, especially elementary age kids, I mean, they are resilient, they're creative, they love being outside, and even without playground equipment, they're going to find a way. It's going to be good for them. So yes. Yeah.
Thank you. No, thank you for that. And Dr. Fox, thank you so much for talking about the playgrounds, because that was the question the parents had. Like, if they're going to go out to recess, they're going to, get on the swings and do all that stuff. They're touching, right? So thank you for clarifying that they're going to be closed down.
The other thing, just to throw in, like being outdoors, that's a whole other thing than being indoors, right? You have the benefit of being out in the open air, and we know that's a safer situation anyway. So with recess happening outside to the extent possible, that's what we're going to be doing.
Absolutely.
Fantastic.
And then of course, the hand hygiene at all transitions, right? So every transition during the day, it's, you wash your hands. So you come back in off the, out of the field, out from, back in from recess, hand washing is going to be, hand hygiene is going to be essential as well.
Fantastic. Thank you so much. Yeah, and I know that we talked about it, I think, in another session where, when they're going to be moving, if they go to the bathroom, hygiene, right? Like, they're going to be cleaning their hands all the time. So thank you both for that. The other question that a parent submitted was, I want my kid back in school, but is it worth it for them to only go 2 days a week?
That is such an important question. That's the hard. Dr. Z, I'm going to just put you up there.
Yeah, I mean, I would say yes, from a professional standpoint and a health standpoint. I mean, we know that high quality education is linked to all sorts of health outcomes, lower risk of chronic disease, lower risk of several different medical conditions. We know that high quality education and being present in school is linked to, greater lifetime earnings, even extended life expectancy. We also know, you know, as parents, as educators, you all know this, and even as a physician, I know this, that, you know, the school serves so many other functions besides as your education. Of course, education is extremely important, but the social emotional learning and the socialization that takes place in school, you know, even things like meals, health screenings, all these things are essential and really need to be done in person to an extent. And so these are all the benefits for having children come to school in person, even if it's just a couple times a week. And of course, that's a decision for families. I mean, the logistics can be very difficult, particularly if you have two working parents. If you have, you know, if you're a caretaker for other family members and you've got to know how to get your child to and from school and what's going to happen on the days that they're not physically in school. Of course, it's a huge balancing act for most families. But those are, you know, there are many, many benefits to having the students there, even if it is only 2 days a week.
I agree, 100%, 100%. It definitely is. Yeah. I mean, I'm looking at this from, you know, from the perspective of a pediatrician. Yeah. Kids will learn better in person. I think that's obvious. You know, they're going to be trying to learn however they can. They do it. You see them trying to do it. But there is no substitute for being in person with a teacher, a qualified teacher, right? Kids learn better in person. And I guess I just would say, you know, they're gonna lose some ground, right? For all of this, but they're gonna lose less ground if they're there at least part of the time.
Got it. Thank you so much to the both of you guys for sharing that with us. I think parents, like you said, logistically, right? Like what do we do? But there's several kids, if they go to several different schools. It's I think, as many of you have said, it's a very personal decision that each family has to make. And what's right for one family might not be right for the next. So definitely figuring out, you know, what is in our household and make the best decision for us as parents and for our kids. So I appreciate that from the
People
both
got
of
to
you
have the
guys.
freedom to choose for themselves what's best for them. You know,
Mhm.
we're hoping that people say, "Hey, we see that you can do this safely in person. Why not? If that's so much better, do it, and let our kids have the same chance that kids in private and parochial schools have, that kids in daycares have."
Yep. Thank you so much for that, Dr. Fox. I think we touched a little bit about the lunch and how that was going to go on in school. So a parent did write one of the questions about bathroom breaks. What is that going to look like, right? How are the lunch going to be done? I know you mentioned lunchrooms or in the classroom. How is that going to look like for kids once they're back?
Yeah, it's going to look totally different than before. I know that much. It's going to be orderly. It's going to be done carefully. I mean, people did take care before, but I think there's special care now. So orderly, carefully, people are going to be wearing their cloth face coverings. They're going to be maintaining their social distance when they go from their pod to the restroom. You know, they're not just lining. You know how kids used to line up one right next to the other, and they're talking to each other and tapping each other and playing around. No, they got to stay 6 feet apart. So orderly, carefully, wearing the cloth face covering, maintaining the social distance, and washing their hands when they're done. You know, we encourage the kids to do that before all this, but now, you know, it's for real. It's for real now. So
For sure. No,
those
thank
are
you
the
so much.
ways that it looks different to me.
Yeah, no, and thank you for clarifying that. Like they're going to go together in pods. They're going to be separated so that they know they can't hang out like before, like when we were growing up, right? It's gonna definitely look different. So thank you for that. One of the other questions a parent submitted, I think you touched a little bit on it. It's about what happens if a teacher tests positive, right? Well, the group that the teacher had contact with, what's going to happen to them? This parent works in in the health industry, so so they know a little bit about it. They got vaccinated, and they're waiting for their kids to get vaccinated. So also like the question of vaccinating kids. So can you talk a little bit about that? So about the what happens to teachers, like if they
The teacher, right?
yeah.
Okay, so yeah, so really we think about the teacher and the small number of students in the pod as one unit. Okay, so the teacher in the pod, the teacher's the case. The teacher goes into isolation, and they're considered, part of the pod. The kids in that pod would go to quarantine because they had direct contact with a known case. That's how that works.
Okay, fantastic. So thank you for clarifying that. I think people were, like you were saying, we didn't know about like the initial contact and all that good stuff that you mentioned earlier. So it's good to get clarification for that stuff. The other thing, I think, staying with the cases and testing, for the protocol for students, if there's a student, again, that it tests positive in a pod in the classroom, what is the protocol that CPS is going to be using then about that specific pod? What happened?
Yes. Okay, that's an awesome question. And we have some great like infographics on this. If I share this with you after, can you share it with the group? I don't even.
Yeah, absolutely. Yeah. So after our session, by tomorrow, I will send out a email to everybody that participated, and we'll send links to the presentations and to the video because it's being recorded. And I can send whatever you email me.
That's great. This is also on the website, but if we could just put it in people's hands right away, that's even better. So the key thing is that people report the positive test results, so the positive cases. We want to know about that as soon as possible, promptly. And the way to do that, the best way to do it, is to do it online. It's super easy and fast. You go to cps.edu/COVID results. That's all there is to it. You click on it, you put in the information. It takes about, a minute or two. And then our contact tracing team, we have a whole team of people now to deal with this. We receive the report from the parent, and then we go to work. We call the parent and we talk about the specifics of that case, what the situation is exactly, because every case is different. We collect those details. We also we look at other data sources. Then this doesn't even, the parents doesn't even have to worry about this. But what we do, we find out who was in the building, what pod were they in, and all the rest of it. We consult these other data sources, and we put that whole package, that whole picture together, and that's how we know what is the right guidance to give to the school. Okay, part of the guidance, I would say part of this is like getting the details exactly right and collecting the right data, and then analyzing things in the right way so that we know the right guidance. Once we know what the guidance is, we notify everybody in the school. We're notifying those direct contacts. So the kids in the pod, boom.
Got
The
it.
direct contact of a case, they're going to quarantine for 14 days.
Got it.
And their teacher is too.
Got it. So everybody in the pod would do it. And I think that's very important that you're saying you're going to let, obviously, the parents, right, know. So it's very important for us to have correct information. Call your school, make sure we have good phone numbers, good emails.
So right. We can't rely on secondhand information. Oh, I heard XYZ person has this, or, that's what's in the rumor mill or whatever. You shouldn't be discussing other people's private health information in the first place.
Yeah.
Okay. But what I'm telling you is that we cannot act on secondhand information, rumor or speculation, period, because that always leads to trouble. We want to hear directly from the parent, preferably, at that cps.edu/COVID results. But, if people want to call you can do that. I'm discouraging it. It's much better. It's much more complete and efficient if we get all the data at one time. It's not like having to call back and forth type of thing. But if people call the Healthy CPS hotline, then we can do it that way. We get some preliminary things first, you get handed to the contact tracer and we go from there. But that's just more steps. It's not the ideal way, but we can do it. So that number, it's 773-553-KIDS, KIDS, 773-553-KIDS. So it can happen that way, but the easiest way is, at cps.edu/COVID results.
Sure. Thank you for that, Dr.
And we
Fox.
notify everybody, not even just, definitely the direct contacts, but anybody else who was in the building on the days that matter, they get notified too. We'd be telling them, oh, we investigated this case. You are not a direct contact, if that's what the situation is. Definitely the direct contacts, boom, to quarantine. If you were there in the building on that day where case, you're going to get notified too, but that notification is going to be, we investigated the case. You are not a direct contact. We know that because of the specific details collected by the contact tracer.
For sure. No, thank you so much for making that clear to parents. I know we get antsy just thinking about it, so I appreciate all the detail. I'm not sure if they opened the chat. I want to see if the parents had additional questions. So if it wasn't open, if we can open that now. I know we have a few minutes so they're popping in. Let me see. Sorry, guys, I'm going to try to get to one of those, so I apologize. Okay, so there's one here. Let me see if I can. Sorry if there's one question. You said the most important strategy to stay safe is to wear masks. What about children with mask exceptions and the potential of exposure to other children in that classroom? Can you talk a little bit about that?
Yeah, that's such a tough situation. I'd say the first thing is we just try to move heaven and earth to get the kid to wear the cloth face covering. Sometimes if you make a game out of it, you let them choose, let them have control. They choose the style of it or the way it looks or whatever, how the way it fits. There's different kinds. Let them participate and let them practice, get used to it, and let them see people, their peers and everybody else in the world wearing cloth face coverings. But sometimes it just isn't going to work. Okay. In those situations, we can have alternative kinds of protection. And we could use a face shield. That's possible. It's some kids. Okay. But, that's not nearly as good as a cloth face covering. So people can be granted these special accommodations. There's a specific way to do that. That's serious business. And we don't want to take that chance and we don't have to. But, if we have to, we have to. The good thing is that there are many other layers of protection that are in place. So, let's say they're not wearing the mask and they can't wear anything else, not even a face shield, right? We can't exclude that kid legally. We can't. It's against the law. We would be sued, and it just isn't possible. We can't exclude them, but we can use those other layers of protection, like making sure everybody else wears their mask, making sure everybody else is staying 6 feet apart. I mean, they're supposed to do that anyway, but we might give them even a little bit more wider berth if possible. But we've been much more strict on, all the rest of the strategies that we might have been given this particular circumstance. So
for sure,
we can't exclude them. And but we do have these other things that can help to protect them and everybody else.
Yep. Thank you for that, Dr. Fox. I'm going to go through one more question. I know we're running out of time, so we're going to do one more question. Thank you, everybody that is writing. We're going to try to go through those separate from the meeting, and we'll update a Q&A, and we'll send it to you guys as much as we can, answering the questions you posted. One of the questions here, I know a lot of parents say this to me, so it's a good question from one of our participants. Says, my son gets a runny nose in cold weather, not because he's sick, it's just because it's cold. Will he be sent to the care room and then home and quarantined because this is happening to him?
Right. Well, we asked, I mean, I'm well aware of that as a pediatrician, obviously in Chicago, when you're making those transitions from the cold to the warm, yeah, your nose runs a little bit. That's true for me too, right? And everybody else. So what we've helped the staff in the school to understand is that, you don't just, for a situation like that, you have to take those things into account, and that, you give people some transitional time to get it together, okay, with the runny nose and the weather transition, right? Okay, they're not going to sit up there all day and do it. You wouldn't expect that, but maybe 20, 30 minutes, maybe even up to an hour. That's okay, okay, for that particular symptom. Now, if it's a different situation, you got some more concerning symptoms, you're coughing and you're hacking and, no, you're going to the care room right away. Okay, but for a runny nose in the wintertime when people are making a transition, people know to take that into account.
Sure, thank you. Dr. Zimmerman, is there anything that you would add to that?
Yeah, I would add that. I mean, when my kids started in in-person learning, and my kids they in previous years have been sick almost continuously, from like August when they start until January or February. But what I found this year is, I think because of all the mask wearing and all the precautions that people are taking, they really have not had the usual sniffles and runny nose and congestion, because I think we're also avoiding other respiratory viruses that are commonly in circulation right now. So I was expecting to have problems with that. I was like, wow, are my kids going to get sent home like every other day? But it turns out that with all the precautions we're taking, we're much less sick this year than we ever have been in school.
Got it. No, thank you so much for it, especially since your kids have been in school and this happens to them. Thank you so much for sharing your experience. We're in the chat. We're actually going to start putting the information for our next event. We're going to have Chief Carson from Facilities join us next week. So my colleagues are putting it in the chat. You can click on that RSVP. One thing, I know we're over time a little bit, but Dr. Fox and Dr. Zimmerman, from all the things that you say, I know it's a lot to take in, a lot of information that parents are trying to process. What are the key takeaways, the 3 key takeaways that you would want parents to take tonight from this session?
I would say parents have power. They can protect their kids while also having their kids learn in person. We know this now. And that's what we are, urging people to do. So parents have power. Parents have the freedom to choose what's right for them and their families. And that there are layers of protection that are put in place here. That's what we're talking about when we talk about mitigation strategies. And we're serious about that. There are many layers, and we're going to use them all to keep everybody safe and healthy as it can be.
Thank you, Dr. Fox. Dr. Zimmerman, is there any takeaways you want parents to take from tonight's session?
I mean, I would echo the same. I don't have anything more eloquent to say. I think Dr. Fox said it beautifully. And I just want to offer myself as a resource. I'm happy to talk to parents. And Dr. Fox, I can help you tackle some of the chat questions as well.
Thank you.
Yeah, fantastic. Well, thank you so much to the both of you guys for sharing your expertise. I know that there's a lot of questions we didn't get through. Parents, I know you're still putting some in there. We're going to take a look at those, try to work hard. Give us some time, so please be patient. There's only Dr. Fox and Dr. Zimmerman. They're going to tackle some of this stuff, so please be patient. I will send an email to you all tomorrow with some of the links that we put on the chat, as well as some of the information Dr. Fox is going to send me, and we'll share the presentation with you guys so you have it. This video is going to be up on YouTube, so you can share it also with other families who were not able to make it. And if you want to rewatch it, because some information maybe you forgot, you are welcome to do so. Again, Dr. Zimmerman, thank you so much for joining us, giving us an hour of your time, a little bit over an hour now. Dr. Fox, same to you. Thank you so much for joining us. And parents, thank you so much. Hopefully you found this helpful. And thank you for giving us your time. I know it's been a busy week and it's a long week and it's in the afternoon and the kids are probably trying to get dinner. So thank you so much for giving us your time. Appreciate it. Have a great night, everybody.